recognizes the ranking member for opening statement. I yield to the ranking member for an opening statement. I yield back.
Good morning, Madam Chair.
Thank you, Madam Chairman.
Distinguished gentlelady from California, Mary Bono. Gentlelady is recognized.
Chair now recognizes
the lady from California is recognized.
I'm pleased to introduce Congresswoman Mary Bono, former U.S. Representative for California's Inland Empire and Desert Region from 1998 to 2013.
Mr. Speaker, I yield myself such time as I may consume.
Gentlelady is recognized.
Hello and welcome to Sagely Speaking. I'm your host, Mary Bono. I've got a fascinating guest this week who I'm very honored to have with us. Today we have Dr. Beau Kilmer. I'm going to call him Beau. He is the co-director of the RAND Drug Policy Research Center. He is a senior policy researcher at RAND, a professor of policy analysis at the Pardee RAND Graduate School. His research lies at the intersection of public health and public safety, with special emphasis on substance use, illegal markets, crime control, and public policy. If that doesn't keep you busy, I don't know what will. But let me just tell you a little bit about the RAND Corporation. They're an entity that I highly respect and have relied on a lot over the years, especially during my time in Congress. The RAND Corporation is an American nonprofit global policy think tank, a research institute, and a public sector consulting firm. RAND Corporation engages in research and development in a number of fields and industries. Since the 1950s, RAND research has helped inform United States policy decisions on a wide variety of issues. They develop solutions to public policy challenges to help make communities throughout the world safer and more secure, healthier, and more prosperous. But if you look at the history of RAND, it is fascinating. And I encourage you to go to rand.org and look them up and read about them and how they came into existence and all of the great work they're doing now. Policymakers always rely on RAND for information and to help them guide their decisions. So let's go to Beau Kilmer. Beau, thank you so much for being here and joining us on Sagely Speaking. What inspired you to do what you do, and how did you end up at RAND?
Well, Mary, it's a pleasure to be with you and to be on the show. Honestly, I started as an intern at RAND 27 years ago, and I never really left. What I thought was going to be a 3-month internship turned into, when I was an undergrad, at the end of the summer, they asked me if I'd keep working for them. So while I was finishing up my undergrad, I was still doing RAND work. And then as I got more skills, I was able to do more. And so when I was doing my master's degree as well as my PhD, I was primarily working with folks at RAND. So when I finished up, I knew it was where I wanted to be. I really liked the people, and I liked the questions that they were asking. And, it's a nonpartisan, nonprofit research organization. And so they can tackle the controversial issues and, without coming out and seeming like we're advocates on one side or the other. And so I really appreciated that. And I also saw it as a place where I could do my own work and answer my own questions. And so, so it's been, I can't believe it's been more than half my life. But I wouldn't want to be anywhere else.
Well, I think you've summed up RAND pretty well. I always thought they tackled very complex issues and did it in a way that was non-threatening to a policymaker or politician. They really make you listen and think.
Yeah.
And that's something, actually, thinking is sort of something that's lacking in today's world. Yeah. But my hat's off to you. But when I look at your pedigree, your education, oh my gosh, Harvard, Berkeley, where else?
Michigan State. Really? I did my undergrad at Michigan State.
So my first question to you is, I guess you couldn't get into USC?
Yeah, it was interesting. So I was doing my undergrad at Michigan State, and I was really interested in drug policy. And I'd written a few pieces, and so I started applying for internships at organizations that were doing research on drug policy. And we're talking about mid-90s now. Back then, most of the organizations were either kind of very pro-legalization or anti-legalization. I didn't really fall into either of those camps, but I thought, what the heck, it's a summer. So I was sending out different letters to different places, and then all of a sudden I stumbled upon RAND. I'd never heard of RAND. So, I was digging in, learning about all the different research they were doing, and then saw they had this drug policy research center. So I redid my cover letter and sent everything out, and I got lucky in 2 ways. First of all, it turns out the person who opened up my letter in Santa Monica, where RAND is headquartered, she happened to be from Indiana. So we had this Big Ten connection, and she was a big fan of getting people from the Midwest to move to California. And at the same time, there were two researchers who were working on, I would argue, the seminal book in drug policy, Drug War Heresies. That's Peter Reuter and Rob McCune. They both had been at RAND, started writing a book, and then they both went on to different universities. And so the book had kind of stalled. And so this woman who opened up my letter in Santa Monica thought, well, maybe if we could bring this kid out for 3 months to kind of do a lot of the grunt work, fixing the footnotes and all those things, maybe we could, maybe we could move things, move the book along. So they invited me out for the summer, and so not only did I get to learn about RAND, but that's where I learned about the field of public policy. I didn't know that was an actual kind of area of research or of study. And so when I got back to Michigan State, I was ready. I grew up in Michigan. I was ready to move on. And, they didn't have a public policy program. So then I started looking at some of the different public policy programs that were out there. And I ended up having to choose between going to University of Michigan, my arch rival, or UC Berkeley. So I was like, stay in Michigan or go to California. So I came back to California and really haven't left.
Oh, I get it. My parents fled from Cleveland, Ohio in the 60s, California. Yeah. It's easy to do. Yeah. It's easy to do. But mid-90s drug policy to now. Yeah. Are you surprised with, is it moving well? Is it stalled?
Where are we? As a researcher, it is fascinating. So when I got into this, I actually started doing research in drug policy in high school. I was really interested in learning how other countries were dealing with their drug problems. And you would hear about how Europe was taking a different approach. And then you would also hear about in the United States, we need to, treatment works, but, health insurance wasn't covering it. And so early on, when you wanted to learn about what was happening with drug policy, you really had to kind of look at what was happening in other countries. And I'd say the biggest change that's happened over the past 15 years has been the amount of change that's happened within the United States. Starting with medical cannabis, then with cannabis legalization for adult use. And now you see a lot more change happening with respect to psychedelics, such as psilocybin. And so now it makes it a lot easier to learn about, some of these different policy developments, both the pros and the cons. So I would say that's probably been the biggest difference from a research perspective.
So are we headed the right way?
It depends on your perspective. Like, for example, with respect to, for example, cannabis. So I've been doing a lot of research on cannabis for the past 15 years, cannabis policy. And for decades, people have been debating in dorm rooms and at dinner parties about whether or not you should legalize. But, being in California around 2009 and 2010, you really kind of got the sense that the conversation was starting to change. It was starting to get a bit more serious. There was legislation introduced in Sacramento, and then there were discussions about there being a ballot initiative in California. There have been ballot initiatives before, but one that potentially could pass to legalize cannabis. And being here in California, we kind of saw both sides kind of talking past one another, using really big numbers that made it hard to kind of have rational discourse on this. So with some of my colleagues, we decided to put out a piece saying, hey, here's what we know about cannabis, here's what we don't know, and here's some of the things you need to think about with respect to cannabis legalization. And, and that's the nice thing about being at RAND. We're not an advocacy organization, so we can be honest about, hey, we just don't know the answer to this, or we just don't have enough good research on this. And I'd have to say, so that early work that we did in 2010, kind of thinking about, well, what would happen if California were to legalize? I'd say one of the biggest takeaways from that was that there could potentially be a really large decrease in the price. And so that was no one was talking about price at the time. But if you think about all the outcomes that get featured in legalization debates, what's going to happen to consumption? What's going to happen to the size of the illegal market? What's going to happen to tax revenues? What's going to happen to the profitability of businesses, which is important when we talk about social equity? All of those depend on what that price is going to be. And for a number of reasons, we thought that, after legalization, you're going to see this large decline in prices. Because a lot of what you're doing, like if you're buying cannabis back in the day or methamphetamine or cocaine, when you're paying for it, a lot of what you're doing is compensating the drug dealer and everyone else along the supply chain for their risk of arrest and risk of incarceration. With legalization, that goes away. And then also, just easier to take advantage of technologies. And also, if you allow for really large grows, you would expect those prices to decline quite a bit. And so I remember back then we had predicted that over the course of years you could see potentially an 80% decline in price. Now, as I said, no one was talking about that at the time, and I remember people saying, what do those RAND nerds know about growing cannabis? But we talked to people who were growing legally and in other countries, and we had a good sense about that. And sure enough, that's what we've seen. As more places have done this, we've seen really large declines in the price. And now, Mary, getting back to your question, are we making progress? Well, it depends on one's perspective, right? If you're someone who is a heavy cannabis user, you're going to love legalization. It's reduced the prices. It's increased the number of products that are available for you. And so I think a lot of people who, kind of in that camp think this makes a lot of sense. But if you're someone who's focused more kind of on the public health consequences, you look at kind of what's happening in terms of the proliferation of products, especially the products with high concentrations of THC, and there's a lot of concern there. Now, I want to be very clear. If you're going to move from prohibition to legalization, you don't necessarily have to allow all of those products. For example, in Uruguay, which was actually the first country to legalize in 2013, there they have a legal market, but it's very restricted. If you're going to purchase the cannabis from pharmacies, they control the THC levels, they control the number of products. It's much more restricted. But what's happened in the United States is as we've gone from prohibition to kind of medical to now this kind of adult use legalization, we essentially have let the companies decide. Very few places have any types of limits on the products that are sold. Or the potency. The one exception is with the edibles. But you can still go in and buy some of these concentrates that are 90% THC. That's a policy choice. You didn't have to do that. But that's kind of how it's rolled out here in the United States. And so some of the other work that we were doing on legalization was also helping people understand that, look, if you're considering these alternatives to prohibiting the supply, you've got a lot of options. You could just allow people to grow and give. You could have a state monopoly or state stores. You could just allow some of these cannabis social clubs. There are a lot of things you could do, kind of middle ground options. But that didn't really get much attention here in the United States. However, when you go outside of the U.S., there's much more interest in some of these middle ground options. For example, Germany was just legalized. They allow people to grow it at home, and now they're allowing for these kind of social clubs, where it's almost like a collective. You have to belong to a membership group. There won't necessarily be the advertising. There won't be the profit motive. That's just starting to roll out. So it's going to be fascinating to see how that plays out.
It concerns me, though, Beau. I got started in this work because of my frustration and anger with, the manufacturers of opioids, and that these legal drugs, these highly controlled, legalized drugs were killing kids. So we had, there's over a dozen federal agencies with some role in the legal drug supply.
Yeah.
And yet people were dying and we could do nothing to stop it. And I say we could teach college courses on everything that went wrong with this.
Yeah.
I think you could teach, it would be more than a semester.
Yeah.
There's so much that went wrong, whether it's the manufacturers, distributors, the DEA, DOJ, let's go down the list. And that's what concerns me. So every time we say, if we regulated it, we could make sure it wasn't harmful. It's like, the regulators don't always do a good job. And so when you say perspective, I think my concern is, like you said, the public health. Is this improving the health of the American people? Is it improving their physical and their mental health? So that's always my perspective. Is this a good idea? So, I think it's fantastic that you've researched it and you know so much about it. But when you talk about, the cartels are still undercutting. Whatever price the American market sets, don't the cartels come in and undercut it and steal that business?
It depends. And so, so what we have in the United States is, we have this patchwork, right? You've got 24, 25 states that have passed, cannabis legalization. But that still means, more than half the U.S. population. But that still means you've got half the U.S. population living in states where it's prohibited. So you still have a fair amount of illegal production happening here in California and in other places, that's going to other parts of the country. And so, for example, if you look at, Canada and Uruguay, they legalized nationwide. And so definitely you still, you do hear, there is a large illegal market. But when you talk about the illegal market, like for example in Colorado, if you look at most of the cannabis that's consumed by state residents there, the vast majority is coming from the licensed stores. Now that doesn't mean there still aren't illegal grows happening in Colorado, and where product is being moved to other states. But this gets to this other important question. So a lot of the work that we've done is thinking about not only there are pros and cons to who should supply this if you're going to go down this pathway, but then there are a number of what we would call design considerations, other policy issues you need to think about. And one of the big questions is, if you're moving from prohibition to legalization, how much money are you going to put into enforcement, right? As you're moving people, because it could be the case that you could end up spending more money on cannabis enforcement after legalization, those first few years, than you did beforehand. If the goal is to really try to crack down and try to shut down some of the illegal grows and stuff. But states have taken very different perspectives on this. I don't think enforcement in most places has been a major concern, unfortunately. And so, look at what happened in New York. New York legalized. And after a state passes, it usually takes a couple of years to kind of get the regulatory infrastructure up and running, get out accept the licenses and then kind of give them out. And so you saw that after New York State legalized, in that period before the stores opened, you then saw people starting to sell cannabis in bodegas. And very much illegal under state law. But no one was really enforcing the law against them. And then it just proliferated. So, you hear these numbers now about New York City, this may have changed, but, there were 1,000 places selling cannabis illegally. And so the problem there was, you should have nipped that in the bud early on. Because what ends up happening is once you have this really large kind of market, and we see it with the retail shops in New York, it makes it then harder for those that get the licenses to compete, because they're not necessarily paying taxes on this. And so the one thing that I thought New York did that made a lot of sense is that they said, okay, when we first give out the retail licenses for cannabis, we're only going to give it out to those who are equity applicants or those that are nonprofit organizations. So that was their original plan. However, when they gave those licenses out, those entities then had to compete with all these bodegas and other people selling illegally, making it much harder. So enforcement has to be part of the conversation. And unfortunately, it really hasn't been.
Well, Beau, it's funny you say that because we're seeing the same thing with these illegal vape products that come in from China that are not healthy. They're filled with heavy metals. God only knows what's in them, but it's the same exact problem. Is they are illegal, they're being smuggled in, and a lot of these small shops don't even know they're illegal products and their customers want them and they're selling them. And here we are back with this public health nightmare of what's in these vape products. So it does continue. There's a continuum of these things. I'd like to take this time to thank my incredible sponsors. Lucy Pet Foods is the leader in gut health. Their formulas for life feature prebiotic balanced fiber that nourishes your dog and cat's total health. Every purchase helps support the Lucy Pet Foundation, a 501c3 charity helping animals. Get free shipping from LucyPetFoods.com. Mothers Against Prescription Drug Abuse, driving solutions to prevent drug abuse and overdose deaths by focusing on prevention through education and awareness. All of our sponsors can be found on our website at sagelyspeaking.com. This episode's code word is Falcon. And now, back to our interview. Can we move into fentanyl? Because I really want to hear your thinking on fentanyl and why we are where we are with so many Americans dying from this product. And, a lot of my friends say, Mary, you focus so much on fentanyl and the opioid epidemic and why. And, to me, we're not going to save 100% of people. I get it. But half of these overdose deaths and fentanyl poisoning deaths are preventable, I think. And it's worth fighting this fight. But why? How did we get where we are with fentanyl?
Yeah, well, it goes back to what you were talking about with OxyContin. And we know that, research by my colleague, David Powell and his co-authors have shown that, it was definitely with the advertising, the promotion of OxyContin that we then saw, we really saw this proliferation in opioid use disorder, and that it's had effects for, decades afterwards. And, but what you were in a situation where you had this large pool of people suffering from opioid use disorder. And then you saw some places beginning to crack down on making prescription opioids available, but people didn't necessarily. A lot of people weren't necessarily then moving to treatment. And so, look, we've always had heroin markets in the United States for decades, but you then began to see more people beginning to move to heroin. In some places it was easier to get, it was cheaper. And so you kind of saw people then moving from just getting kind of diverted or getting products from, those that were produced by pharmaceutical companies to them moving to the illegal market. So you kind of saw that transition 2009, 2010. So you kind of had that happening. And then at the same time, well, I would say a couple years later, you really saw this influx of illegally manufactured fentanyl. Now, so let's be clear. Fentanyl is an amazing drug. I mean, it's used in hospitals, and as a pharmaceutical, it really is. It's very powerful, and it really has improved the lives of many people. But what was happening with fentanyl around 2013, 2014? It wasn't that there was a lot of fentanyl being diverted, from hospitals or patients. This was stuff that was illegally manufactured in China, and then being kind of shipped over. And early on, dealers realized, wow, if I've got this kilo of heroin, I sprinkle in a little bit of this fentanyl, which is cheap and it's a lot more potent. My heroin, it can go a lot further. I can make a lot more money. So at that time, it wasn't as if people were asking for fentanyl. It's just the dealers were putting it in there. And so then this really started kind of in the Northeast, Midwest, and you saw, and you really started to see an increase in the number of people overdosing and dying, right? Because they were putting in small amounts, and it doesn't take much, there was a lot of variation in the packages. So even people who had a tolerance to opioids, sometimes they would use a batch that had a fair amount of fentanyl in it, and they would overdose and die. And so you kind of saw that happening, but early on it was in the Northeast and Midwest, and I would say, but it didn't really spread west till later. And there's a big question about why did it take so long to hit San Francisco and the rest of the West Coast. But one of the interesting things, so early on, people they weren't looking for fentanyl. But then once people started using it on a regular basis, realized that fentanyl is so potent, it raises your tolerance levels. And so you then got to this point to where in a lot of places, fentanyl started to take over. And so it was actually harder to get access to heroin. And it was fentanyl. So you kind of had that happening. And then there started to be this transition. It's hard to say when it officially started, 2017, 2018, 2019, sometime in there, when the Mexican drug trafficking organizations, they realized that they could actually start producing this. So what they were doing is they were still getting the precursor chemicals from China. So they were sending them over, but then the Mexican drug trafficking organizations really started producing a lot of fentanyl. And fentanyl is easy to produce. I don't know if anyone saw, there was that Reuters story that came out just last week or a week and a half ago, which just showed how easy it was to obtain these substances. And you don't need big labs, and it doesn't take a long time to do it. And so then you really began to see, we already had a lot of people dying from fentanyl, but then you began to see, especially with the counterfeit pills. We had issues with the counterfeit pills for quite some time, but you really saw this increase in the number of pills that they would look like a Xanax, they look like OxyContin, but they'd really just had fentanyl in them. And so you began to see that kind of move over the border. At the same time, you saw, fentanyl really starting to take off more in California and on the West Coast. And the thing is it's really cheap and it's so potent. You don't need a lot of it. So we did some work. So RAND. So I've been working on this issue on studying fentanyl and fentanyl markets for over 5 years now, and kind of then we had done a fair amount of work on this. And then there was a bipartisan. It was a commission on combating synthetic opioid trafficking. And so this was a bipartisan, bicameral, multi-agency task force, and they asked RAND if we would actually do the research for them. There's a whole political document, but then there's also a lot of research that we were doing underneath and we're kind of behind the scenes. And this was great because we were able to get access to data that we normally wouldn't get access to. And Mary, that's something we should come back to. The fact that we don't know how many people use heroin or fentanyl in the United States is a travesty for a number of reasons. But we were able to get access to a fair amount of data from the DEA and other agencies. And there were kind of two really interesting takeaways. The first was that the total amount of fentanyl, pure fentanyl, illegally manufactured fentanyl being consumed in the United States was probably, this is 2021, was probably in the single digit metric tons. Now, it's kind of hard to put that in perspective, but we probably import more than 1 million metric tons of avocados from Mexico every year. So this is a very small amount, and it doesn't come over pure, but if it did, I mean, this is enough to fit into one semi-trailer. This is not a lot. So it really does challenge this idea that, that we're going to be able to significantly reduce supply at the border, because it's so easy to move this over because it's so potent. But the other thing we found is that fentanyl already, we're kind of getting more bang for your buck. It was cheap, it was potent. But what we were able to find is at the wholesale level between 2016 and 2021, the wholesale prices actually declined by about 50%. So, I mean, it was already cheap and it was just getting cheaper. And so now you're at a point to where it is, it really has saturated many parts of the United States. And we're at the point to where in some of these places it's so saturated, the idea that enforcement's going to be able to really kind of raise the price of that seems pretty unrealistic. And so that's
but isn't it? I think it's pretty cool though that they took down a couple drug kingpins lately.
Oh yeah.
I mean,
oh yeah. So no,
it's take down the bad guys.
Yeah, no,
I love that.
Yeah, but you raise a really good point there in terms of when we think about the role of drug law enforcement and how we allocate those resources. At this point with fentanyl, it may make less sense to crack down on the border and put more money into those investigations, the money laundering, reducing violence. So I want to make it clear that I'm not saying that there isn't a role for drug law enforcement. There is. But I think we need to be thoughtful about kind of where we're going to get the most bang for the buck. Yeah.
Well, absolutely. But I do, the border is a whole separate issue.
Yeah.
It's a very important issue.
Yeah.
But I agree with you that we need more thoughtful, bigger policies. And I think that this recent enforcement on seriously bad guys was a positive. But a couple of things. And I know you want to go back to data and surveillance. Yeah. But before we do that, there's something that in the policy space where we were flying blind was the transition from, so many people were abusing prescription drugs. The diversion was rampant, the, pill mills, all of these things. Yeah. And to transition from fixing that, where they're no longer, pill mills in Appalachia and Florida that are feeding the whole eastern seaboard. But then when we say, well, when you cramp down on that, we force people into heroin. Now, I'd seen that firsthand. I know that it happened. But that was a big policy snafu. I don't know morally or ethically how we could have said, well, let's go ahead and let them continue to divert or sell, far more pills in one area of the country in one tiny little pharmacy than any other pharmacy in the world. And how we couldn't go, well, gee, that's not okay. And all of these Fortune 500 companies are profiting. Yeah. Plenty of people are profiting. And how we couldn't say, we need to stop this. Mm-hmm. So there's criticism on, well, we stop the diversion of, legal prescription drugs. And that was the cause of fentanyl. And I think that's another college course worth teaching is how do you see a moral, ethical failure and a failure in the supply? Because look, it could be opioids today. Who knows what it could be tomorrow? But how do you make that change?
I think the lesson from that is if you're going to take efforts to massively reduce the supply of a particular substance that that people are addicted to, you're going to want to make sure at the same time you really are ramping up access to treatment. I think that's one of the key lessons. At the same time, if we're going to reduce supply, and we know that there are a lot of people who are kind of getting these diverted products who won't have access to them, we want to make sure that we have that it's easy for them to get access to treatment and get the medications they need. And so I think that's kind of the big takeaway from that.
That's a great point. There was a huge gap.
And there's still
to medication.
There still is a huge
treatment.
gap. Look, I think we've made great strides in terms of increasing access to different medications, but there still are huge gaps. And but I definitely think, and that applies at the national level as well as at the local level, right? If you're going to go in and do some type of local law enforcement action, which we think is going to if you think it's going to have a significant impact on a particular market, you want to work with your Department of Health as well, that at the same time you're ramping up, hey, here's, if you want to get access to treatment, here's where you go, making it easy for people. And so I think that's a place where law enforcement and public health could work together.
Yeah, because we unfortunately, many pain patients now, legitimate pain patients, it's harder for them, and you have doctors who are afraid of enforcement against them, and it's been a bit of a mess for sure. But this is critically important because again, there are so many agencies involved, and I just hope that there was a cautionary tale here that in policies in the future, first of all, we need to jump on them sooner. We had our heads in the sand on the legal prescription drug epidemic for a long time. Maybe, I would say the federal government did for sure. Congress did. And, Congress had the people who were getting money from pharmaceutical companies and also didn't believe this was happening. And the doctors were slow because most doctors weren't a part of the problem. And they didn't think they were a part of the problem, but as a whole, in any event. So I'm hoping that you guys teach that, look at it, write your papers on it. But you want to talk about data and surveillance. That was part of my frustration, specifically with CDC, or even with, NIDA, National Institutes of Drug Abuse, a conversation I had with Nora Volkov about, can we go ahead and study this problem? This is in 2007. And she said, well, I need funding to do the study. And I asked her, can we study the last 10,000 people who died instead of the next 10,000 people who are going to die? So frustration, because researchers, you're right, the data for a long time, there are such huge holes in it. And how do we fix it if we don't even know completely what the problem is?
So, the thing is, the United States used to kind of be the world's leader in kind of drug policy data infrastructure. We had great information on how many people were using these substances, how much they were using, how much they were spending, which helped us get a sense of how much money was going to the Mexican drug trafficking organizations. And we cut some really important programs, and then in some cases, we just didn't take advantage of some low-hanging fruit. So, so it used to be the case that ONDCP, every 5 years or so, would, kind of put out a contract for this series called What America's Users Spend on Illegal Drugs. And so this had been going on for quite some time. In the last two iterations of that, I kind of led those efforts at RAND. And so, because we have our national survey on drug use and health, they survey 70,000 people a year, spend $50 million on this. It's a great resource, if you want to get a sense of what's happening with, alcohol, cannabis, tobacco, also, there's also a great battery of questions with respect to mental health. But if you want to get good information on the number of people using heroin, methamphetamine, fentanyl, cocaine, it's not useful. We did some work showing that, this was, 15 years ago, that it was missing about 90% of people who used heroin. And you're just missing it.
Wow.
So if you're going to come up with these numbers, and this isn't just some academic exercise, right? You want to know the number of people who are using so you can think about how you allocate resources. Are we actually getting, are we increasing the share of people who have OUD that are getting into treatment? Well, you have to know how many people have OUD and how many people are using to even do that. And so in order to figure that out, we'd have to take data from a lot of different data sources. And I'd have to say of all those different, and you're not going to get a precise estimate, but just even getting a general sense of the range is really helpful. And so of all those different data sources, there was one that was the most important. And this was called the Arrestee Drug Abuse Monitoring Program. So this was a program that started in the Department of Justice, I want to say late 1990s. And the idea is they would interview people who were booked into jails, and it was for research purposes. So it had no implications for their cases. So it would ask them about their drug use patterns, how much money they spent, where they, how they obtained the drugs, and a bunch of other questions. And then at the end of this interview, they would say, hey, would you be willing to submit to a drug test? It has no implications for your case, but it can help us kind of get a better sense of what drugs are being used. And so, and most people agreed to do it. And so this started off as, I want to say by 2002, 2003, this ADAM program was operating in about 40 counties throughout the United States. And there were actually discussions about ramping it up to 75 counties. So this was by far the best source of information we had about what was happening in your major drug markets in the United States. Well, then in 2003, the program got cut. It wasn't entirely clear why it got cut, but the program after 2003 was eliminated. And ONDCP realized this is important information to have, not only to kind of come up with these other estimates for the number of people who use drugs, but for a lot of other reasons. So then in 2007, ONDCP was able to they had enough money to kind of start a new, they called it Adam 2, a new version of the program only operating in 10 counties. I mean, 10 is a lot different from 40 and a lot different from 75, but there's information there. And so they kept the program going for as long as they could with respect to their budget. So they went from 10 counties down to 5 counties. And then after 2013, the program was cut. So here it is, the best source of information that we have on local drug markets. And also with those urine tests, it would allow us to get a better sense of what drug people may be using drugs that they didn't know they were using right around 2013. Can you imagine if we had that program fully funded and operational 2013, 2014, when fentanyl was starting to hit? I'm not saying you would have been able to prevent this, but we would have had a much better sense of kind of the market dynamics and what was happening, in terms of how it was spreading. And so I've been on my soapbox about this for over a decade. I mean, this was a cheap program. At its peak, it was about $10 million. And so, and if the federal government's not going to fund it, trying to get states to do it or a foundation. I mean, this is really important information to get. And, in the way, I think another way, and I've been kind of talking to people where it seems to get more traction, is don't call it the Arrestee Drug Abuse Monitoring Program. Call it the Arrestee Health Interview Program, right? So you're not only asking questions about substance use, but also about healthcare utilization, access to healthcare, insurance, and we'll see. But so that's one thing that's been cut that makes it really hard to figure out what's going on in our drug markets. But the other really big missed opportunity is with respect to wastewater testing. So this is the idea of testing sewage. And so, Europe, parts of Europe have been doing this for decades. Australia has a really great kind of national program. And this is where you can kind of test wastewater and kind of see what substances are being used in different communities. And then in some cases, you can actually then begin to back out how much is being consumed. And this is something that really hasn't taken off in the United States. I don't want to look. There are different programs. Some universities will have one. You even hear about some cities having them. But the idea of having a national network for wastewater testing to be able to get information about the use of illegal and legal substances, this is a big missed opportunity. In fact, we've got, this was a big deal during COVID. We were using wastewater testing to get a sense of different variants and kind of prevalence levels in different places. And so it would be very easy just to kind of add on. I mean, you've already got the infrastructure. Take an additional test or two, take additional tests, send it to a lab. And so this is something where we've really fallen behind. And I think especially not only can it allow us to get a sense of, what substances are being used, but you can also think about it as an early warning system. Right? I mean, we're talking about fentanyl now and xylazine and some of these others, but I mean, the substances, who knows what substances we'll be dealing with in 5 years. And to be able to kind of have that network in place, we could begin to see when certain substances are hitting the markets, right? And so that can be useful for public health officials for, putting out warnings, hey, be careful, we're seeing X, Y, or Z in the cocaine supply. It can also be helpful for law enforcement, for helping them think about allocating resources. Because, that was the thing. So we published our first kind of big analysis on fentanyl, I want to say 2019, this book. And as I said, at that point, it really hadn't taken off in the West. And so, our big takeaway on this was, we need to be really innovative on the treatment, law enforcement, and kind of with respect to programs that are called harm reduction. We need to be very innovative and need to get these out now because we didn't think that you'd be able to prevent fentanyl from hitting the West Coast, but if you could have prevented it from getting entrenched, even for a couple of years, you would have saved tens of thousands of lives, right? And so definitely, the wastewater testing, bringing back some version of this ADAM program, these are real low-hanging fruit that could provide a lot of useful information for understanding what's happening and also measuring the effectiveness of these programs. We're putting all this money into treatment. Well, are we getting more bang for our buck? That's really useful information to have.
This is a great pivot. All of this that you're talking about costs money.
Yeah.
And this Congress now, we do, they appropriate, authorize pretty significant amount of funding, and we have the opioid response dollars and the settlement dollars. Are we using all of that money wisely to do things like programs like you're talking about, or to invest in a lasting infrastructure, whether it's opioids and fentanyl today, or God knows what the drug of the future might be? Are we using those funds wisely for the most part, or how do you feel about
Mary,
that?
I think it really depends on the jurisdiction. I think there's a lot of variation in how states are dealing with this, and then also there are larger questions about, well, how much of the money should be put into treatment programs, and how much money should actually go to the families. Because one of the things we've been talking about are the people that are dying from overdose, and and that's something that gets a lot of attention because that's easy to measure, and that is a tremendous harm. But I think that when we talk about kind of what we're dealing with in terms of opioids and kind of larger polysubstance, it's not just opioids now. It's we're dealing with a lot of different substances, but it's not just about overdose deaths. It's also about people suffering from substance use disorder, and also the effect it has on families. And so at RAND, we published a really large volume called America's Opioid Ecosystem in 2023. It's a 600-page volume trying to be really comprehensive about, look, there are a million different blue ribbon commissions out there that have said, here's what we need to do in the treatment system. Here's what we need to do in the criminal justice system. We decided to step back and say, okay, how do these different systems interact or not interact? And let's kind of focus on those linkages. And so I kind of put together this all-star team of different folks who worked on, child welfare, on first responders, and all different areas. And anyways, one of the big takeaways from this is when we think about all the different systems and all the different players, kind of at the center of that, you're not just talking about the people who use drugs, but it's also their family and their friends.
Absolutely.
And so we spent a lot of time on this chapter doing this. But as we were finishing that up, so it came out in 2023, there was a new researcher at RAND, Dr. Allison Athey, and she was a social science researcher at RAND, but she was also a licensed clinical researcher, or licensed clinical psychologist. And she had just gotten to RAND, so we were talking about this project, and she was telling me about the research that she'd been doing on suicide postvention. So she'd done a lot of work on survivors of suicide. And she thought, well, it seems to me like some of this might actually be useful for those who are who are overdose survivors. So we started talking about this, and this is fascinating. I mean, that's kind of I'm not a clinical psychologist, but it's fascinating talking to her about this and her experiences. And so I said to her, we've been doing some work on this, but I realized as we were doing this, we really don't have a good sense of how many people are affected by overdose deaths. So we decided, so at RAND, we actually have something called the American Life Panel, which is a nationally representative survey that we put out a couple times a year. And so Allison and I were talking and said, well, what if we just added some questions to that survey? Let's just get a sense of how many people know or personally know someone who's died by overdose. And so I was talking to her about this. And she's like, that's a good idea. But we also, it's one thing to know whether or not you personally know someone, but you also want to know, did it disrupt your life? And she said there's some questions that she'd seen on some surveys about those who had about suicide survivor or those who have been affected by suicide. And so she said we might be able to bring some of this in. It was in I think it was late 2020. No, it's early 2023. We ended up adding these questions to the survey, and the results were shocking. They were shocking, but it was. We knew the numbers were going to be large, but we didn't know that they were going to be this large. But we found that, so this was a nationally representative survey of those who are 18 and older in the United States. And we found that over 40% of those individuals had personally knew someone who died from a drug overdose. So that's about 125 million people. But then we asked them this other question about, well, how did that death disrupt your life? And of that 125 million, we found that about 40 million people said that overdose death had disrupted their life. And that was really eye-opening. And so we published...
Yeah, I'm sorry to interrupt here, Beau, but I think this is huge.
Yeah.
I think this is really big.
Yeah.
And I don't think people understand. Yeah, I think we sort of look at this on the micro level, one person.
Yeah.
But thank you for bringing this up. And you just opened my eyes to this. This is a massive issue.
Yeah. And so, I mean, it really, and so, in terms of, so we did this survey and obviously, there's a lot more to be done. And so obviously on the research perspective, you want to include some questions like this on your nationally, your other big national surveys, like your National Survey on Drug Use and Health, right? Not only in terms of trying to get a sense of who is affected, but it would also be great to get additional questions. I mean, we had that question about, did it disrupt your life? But we didn't have the follow-up questions about, let's be specific about it. I think that would be really important. And, and for people that do survey design, it's not just adding a question. I mean, you actually want to do focus groups with people so they get a sense of kind of, so you're making sure that the question you're asking is generating, the answers that you find useful. And so this is once again is low hanging fruit. We need to be tracking this because it's not just about overdose deaths. But then also, like I said, I think, with my colleague, as my colleague Allison kind of hypothesized, I think there's a lot that we could learn from suicide postvention that could be helpful. But it also just raises these issues about enhancing linkages for families who have someone who's died from an overdose or died by overdose or has opioid use disorder. We spent a lot of time talking about getting, folks with opioid use disorder into treatment, but it also can be helpful to link those family members to services. And so part of that could be, working with local mental health officials, even working with the treatment providers to get them the services they need as well. And
Absolutely.
And then also, I mean, there's other things too in terms of when we start thinking about this as as it affects the ecosystem and the families. Obviously, there are a number of people who are informal caretakers, you hear of grandparents who are now taking care of kids, and you want to make sure that they get the resources they need so those kids don't necessarily end up in the child welfare system. So there's a lot you could do there. And then also, just making sure that people understand that if you suspect or someone, a loved one who does have an opioid use disorder, you better have naloxone available and you better know how to use it. And so providing those trainings. And so I do think that once we kind of expand this beyond the individuals who have opioid use disorder or those who have died, it really does expand when you think about the social costs of this, when you think about the cost of the families. And then also I think it opens our eyes up to kind of different policy solutions we have for dealing with some of these harms. And I want to make it very clear. Of course, we need to be increasing access to, substance use disorder treatment, for those that, who have those substance use disorders and, increasing access for naloxone. But I do think we haven't done enough to focus on the families and improving.
Oh, you're nailing this, Beau. You're totally nailing this. The families, the community, the country as a whole.
Yeah.
The collateral damage is much bigger than people have recognized or studied in the past. And what does this all mean and where does it go from here? And 15 years ago, when we were losing, 80,000 people a year, or I don't know what the number might have been. I pulled that out of the air, but a lot less than we're losing now.
Yeah.
And it's shocking to think that the trend continues to be as horrific as it is. And we can do a lot. And I think you're nailing it here. We're just about out of time. But before I lose you, Dr. Kilmer, Beau, I want to encourage my listeners to check out RAND Corporation. Again, go to rand.org. This is an election year. It's a very sensitive, volatile election year, and people are very passionate about everything, thanks to media, social media, a whole host of reasons that people are. I encourage people to think and to learn and to educate yourselves by people who are nonpartisan. And look, RAND is one example of a think tank, and there are many. There are those on the left, there are those on the right. Those are then those who try so hard to remain centrist and unbiased. I think this year, more than any election year, it's important to get educated on the issues beyond the headlines.
Yes.
And, people right now, they don't know something. They Google it quickly. They get the one story, the one hit, and they become the expert on it. Yep. And the passionate expert.
Yeah.
And so I encourage people, please, this election year, everything matters. The country right now is a little bit scary, and we are in our tribes, and we're yelling at each other rather than talking to each other.
Yep.
And I think the gift of the future begins by doing your own, educational efforts, looking at places like RAND.org, listening to people like Dr. Kilmer. Whether you agree with him or my other guests all the time, I'm not asking you to. I'm asking you to think. And I think listening to conversations like this, and again, going to Dr. Kilmer's website at rand.org, to begin to look at the issues. This issue we've talked about today is just one of many, many, many
Yes.
that they work on. So I do encourage you to go to rand.org. And with that, Beau, is there anything in particular you'd like to close with?
Well, Mary, I just want to thank you for giving me the opportunity to spend this time with you, and and talk about just some of the work that RAND's been doing on substance use and drug policy. But as you mentioned, that's only one aspect of the work that RAND does. I mean, we have a large amount of work done on health, on criminal justice, on labor, on national security, and I mean, as I said, there's a reason I've been at RAND now for 27 years. I really like the.
You're not even 27
No,
years old.
I started young, but I really like the people, and there really is this commitment to to publishing nonpartisan and kind of objective research on some of the world's most controversial issues. And as I said, one of the nice things about this, about not being an advocate on this on either side or multiple sides, is that we can be honest about what we don't know. But I also want to say, kind of along those lines, another thing that we do not only within our Drug Policy Research Center, but also in other parts of RAND, is really trying to help policymakers understand which studies they should believe. If you've got 3 studies that say this and then 3 studies that say the opposite, that doesn't mean we throw up our hands and say, oh, we don't know. It turns out some of those studies have better methodologies and better data. So in some cases, some of those studies are more rigorous. So we're going to want to put more weight behind those results. So that's a lot of the work that we do at RAND as well. Not only the research we do, but kind of looking at other studies that have been done, trying to help people understand, if you look at the best science that's out there, this is the available answer. But let's also be clear, here's why, this particular answer about this particular state might not apply in other places. So we try to be pretty honest about that.
And that's important. At the end of the day, data, however good data might be, we might have a moral or ethical foundation on things that we just believe in.
Yep.
And so we might disagree at the end, but we should do it respectfully and understand that we're educated and doing our best as a people to come together and drive solutions for the country that make the world a better place. So Dr. Kilmer, thank you very, very much for joining us on Sagely Speaking. It was an honor to have you. I do hope we keep in touch and we work together on a number of your ideas and help promote them. So a huge thank you to my listeners. We really appreciate you. You mean the world to me and to the team at Sagely Speaking. Huge shout out and appreciation to our sponsors. We couldn't do this without you. And until next time, be well.